Here in the US, we've been doing a lot of work to defend the global health budget and the international affairs budget more broadly. It's certainly a very tough time to push for more resources. And I have a real concern, which we can talk about in the Q&A, that as much as Global Health Initiative has a great, bold agenda, it's going to fall significantly short of the $63 billion over 6 years, in part because of reticence in Congress and for other reasons. Based on what I've seen, it's probably going to be about a $12 billion shortfall if things continue on the track they are now. So we need more advocates for global health spending. I just want to end, I know I'm over time, with a proverb. It isn't from the book of Proverbs, but it's an Ethiopian proverb that says, when spider webs unite, they can entangle a lion. And what I love about this image, this metaphor, is that every individual web can be easily broken. But when they combine and they form a much more powerful web, they can entangle something much stronger than themselves. I see global health inequities as a lion that are stealing away the future, that are suffocating the hopes and dreams of far too many children and communities. But the spider web is in this room. It is outside of this room. It's the private sector playing a more leadership role. It is faith-based organizations like World Vision and so many that are involved in CCIH to play a stronger role. And we need a robust role by the public sector, by the US government and other governments to provide not only the funding, but some of the technical expertise and the leadership in order to finally entangle the lion of child and maternal mortality and health inequity. And so I really hope that I can share more of these tools and information with you, and that you'll start seeing advocacy as being core to what you do and who you are, and that you'll join this growing web that can entangle the lion of health inequality. Thank you.
I know Lois took some time away from family to be with us and has a family event to go to at 5. So what I'd like to do is just maybe take one question for Lois and let Lois make any sort of reactive remarks she'd like. And we'll say goodbye to you and then spend some more time with Adam getting some of those tools he's talking about.
My pleasure. Thanks.
Any questions?
I'm Jean Sack. I've worked in Bangladesh for 15 years and in Africa, and currently with JPIGO, part-time. At my age, what can I tell my congressman that will be convincing to help fund what we're doing well here in this country with health and overseas?
Thank you for your service. And thank you for taking the time tomorrow to meet with members of Congress and their staff. What Adam laid out is very much the right approach. I think speak from the heart, reflect on what you've seen in your work and the difference that you've seen the United States make. It's always so important to remember that, if not us, who will do this work? We have a very important and unique role to play as the United States. And reflect on your time here in this country, too, and the support that you feel and you experience in this country. I hope you have a very good day tomorrow. It's very important.
Do you mind if I ask a question?
Yeah.
All right, so I'll take the prerogative. I don't envy your position, honestly. I mean, I think you've done a great job working in very tough circumstances. If you could share a little bit about what are some of the lessons you've learned trying to manage GHI, given that it's working across 3 different agencies. You've got quite a bit of a mandate, but not always all the authority.
We've got about 44 folks going to the Hill tomorrow, Adam, to do some of what you've been talking about. I have a feeling that they've got some questions, and maybe we can talk a little bit about the way to handle ourselves when we're on the Hill, and then maybe also talk about some of those tools. So, and we've got, Amy, good, you've got the mic, so let's jump into it. How about some questions? So what's the first message going to be when you go up to the Hill tomorrow and you walk into a congressman's office? Have you had any discussions about that yet? Y'all are all prepared. You've got everything down. Mona's done such a terrific job that, thank you, Henry.
I have a question that was asked me by a congressperson one time when I was asking for more appropriation. This was actually for population money quite a few years ago. And he said, Dr. Mosley, he says, I hear what you're saying. He was an economist, actually. And I understand it, and I know that this is important, and it does good. But you know, I don't hear this from any of my constituents. This is not something they care about. How do you reply, you know, because in a sense, he himself is convinced, you know, with the data, with the evidence, with the knowledge, with the stories. But he says, in effect, you know, this is not going to get me any votes. How do you answer that?
It's a great question, and certainly one that I've heard a lot in my years. I think there's two sides to that question. One side is that, unfortunately, a lot of the deaths that we're talking about are fairly invisible to the world. They're not the major deaths associated with earthquakes or with tsunamis or hurricanes in some cases. They don't necessarily grab headlines. And so that helps to feed a public perception that there isn't a huge amount of urgency around addressing maternal and child health, for example. AIDS has been a little bit different, and I think that's why it's also had some success, is because AIDS is such a visceral issue domestically, kind of given our own domestic history. When some of the statistics started coming out that, you know, a quarter of South Africa's society was living with HIV and was likely to die from it, I think that issue resonated a little bit more and was able to generate more headlines. And you also had a lot of people who were very outraged at what was happening at the time and used their voices. With that challenge in mind, I do think that it only takes, in many cases, a couple hundred letters, a couple hundred phone calls to put an issue onto the agenda of a member of Congress in their office. Sometimes we think that it takes thousands and thousands of people acting. But in reality, on a lot of issues, it doesn't require that much intervention. And so even having these offices hear from you, and then here's the key, you following up with that office, effective advocacy is never a one-night stand. It takes multiple contacts with a member of Congress or their staff in order to be able to build a relationship and be effective. And even better, you've had a great meeting. Can you now mobilize your organization and some of your supporters to write those letters, make those phone calls, follow up at the district level? So, and again, I mean, I know I'm creating more work for you, but it's really critical because a handful of really committed people can put global health on the agenda for a congressional office, but it does require those citizens to be engaged. I think, unfortunately, there are a lot of people that tend to be pretty passive with their opinion on international assistance and on global health. And we've got to make those people more actively engaged. So just give you one other example. This is a hopeful one that I think we can learn from. I was really involved in the early stages of the Jubilee 2000 campaign and movement. For those of you that weren't familiar with it, Jubilee was kind of, well, the idea was born in Leviticus, and it's very much embedded in the Bible, but the modern day campaign was focused on the crushing amount of debt that a lot of countries in Africa and Latin America owed to bilateral donors and to multilateral donors. And many people starting in the South started arguing that so much of this debt was odious and illegitimate based on the way it was given, the way it was accumulated. And a campaign was kind of born in the UK, and then it spread to the United States around the time of 1998 going into 2000. Well, just in a 2-year time period, because a lot of everyday church folk started writing letters, started making phone calls, started visiting their members' offices, this very obscure issue that was not anywhere in the headlines, wasn't even on the radar screen of most congressional offices, suddenly became this major tidal wave. And huge commitments were made in the year 2000. President Clinton, before he left office, agreed to wipe out almost all of the bilateral debt owed by 40 plus countries to the United States. Then by the time we got to the G8 summit in 2005 at Glen Eagles, the movement had been successful in convincing President Bush to write off a huge amount of debt that the World Bank and IMF had that was owed to them by other countries. So, it was actually interesting because the former head of the World Bank literally quoted Leviticus, and as far as I remember, he wasn't a strong believer of any faith, but he knew about this call for Jubilee to cancel the debts because he had heard so much from citizens, not just in the United States, but from around the world. So movements really can make the impossible become inevitable, but it does require a lot of commitment and sacrifice.